Hello everybody, Dr. Zaid, pediatric orthopedic and pediatric spine surgeon. So I would like today to talk about a very important subject, and I would like to refer to my slideshow here just to elaborate more on this subject. So this picture, it explains actually everything about pediatric orthopedics and why it's different from the adult. So if we look at this photo, we can see that this person has the same size of the baby. But do they have the same anatomy and physiology? Of course, no. So that's what it's all about, and our pioneer pediatric orthopedic surgeon from Canada, Dr. Mercerang, he said that children are not just small adults, and that explains it all. So to go through just the history of orthopedics, in fact, that's the sign where most of the doctors, they know it represents orthopedic surgery. But where does it really come from? Because the whole thing started with Dr. Nicolas André, where he called the science of treating the problems of the bones and joints as orthopedia. And it comes from orthos, which means straight, and pious, child. So the whole thing, it's about straight kids, and this is what we do as pediatric orthopedic surgeons. Today, I would like to talk about something which is very important. I see very commonly in my clinic, and in fact, it's not dangerous at all, or it's not serious at all. So it's what we call it the physiological phenomena. So the things which should be in the child, and the parents shouldn't be worried about it. But in fact, I call these conditions, because they call it a non-disease, but I call it WPS, and that stands for Worried Parent Syndrome. And it's kind of funny, but actually that's exactly what it's about, because I see the parents, they come, they are really stressed about the fact that their kids, they have some condition or the other, and in fact, it's nothing to be concerned about. So these are, for example, if they have bowing or knock knees, if they have flexible flat feet, if they have what we call it in-toeing, that the kids walking with the feet to the inside, and if they have a very small shortening of the leg, one is shorter than the other, or if they have a small curve in the back when they are standing. So to look at the first fact about the alignment of the lower extremities or the legs. So we see here from this graph that all the kids are born with what we call it varus, which means the legs are bowed. This is due to the fact that their intrauterine position are like that. So they will be born with the fact that they have the bowing, and this will increase at the age when they are standing and walking, and then it decreases and goes to the other side. It means that it will be like knock knees, and this after the age of 2.5 to 3 years, which will be the highest, and then it starts to correct. So all of us has a bit of knock knees, and this is the normal. So if you see an adult that have bowing of the legs, this is not normal. So the other thing that we have to see here is that these are two sisters. You can see this is the youngest one with bowing of the legs, and this is the older one with the knock knee. And this comes with time, and it's very normal. The next one is this, flexible flat feet. So flexible flat feet, it has to be there. Kids who doesn't have flat feet at the age of, up to the age of 3-4 years, they are not normal. And using special shoes and insoles, it was beaten with a very nice study done 31 years ago. Yes, 31 years ago, that showed that if you use special shoes or insoles, it has a negative impact and it gives you worse effect on the foot. Just like, like it's the opposite exactly of what we're thinking, that it will correct the arc and it makes it nicer. So the more kids, and this is what the study showed, the more kids walking barefooted, the better it is. So this is also normal, and we can see the normal development of the feet. This is what we call flat feet. As you can see, the impression of the foot is completely flat on the sand, and it develops with time. Now let's talk about, how the kids should stand and walk. If we look at this slide, should they stand and walk like Charlie Chaplin? Should the feet be completely aligned and completely straight? Or should it be like that, a little bit with what we call it in-toeing? So in-toeing, it comes from the fact that the toe turns to the inside, so it's in-toeing. So if we think about all the kids when they are born, they have some rotation in the hips, which are a bit to the front. This makes them more comfortable in sitting in the W position. And when they are walking, you will see that one of the feet will turn a bit more to the inside than the other one. 80% will turn the right side, 20% will turn the left side. But in either way, usually the rotation of the hips are completely symmetrical. So just to say one sentence, that kids who are above the age of 2 years, if they are walking like Charlie Chaplin or with the feet to the outside, or some would call it the duck walk, this is not normal. The normal, it should be more as in-toers, like here, and this will improve with time and will get more aligned. And just to let you know that even if they would preserve a bit of in-toeing, even in the adulthood, it's not a big problem. The bigger problem is actually if they are out-toers. So if we look at the measurement of the leg length, because as I mentioned, one of the things, they might have one of the legs a bit shorter than the other one. And whatever, like the difference, if it's below 8 millimeter, that considered to be acceptable. Of course, it needs to be investigated. It needs to be followed up, but it's not dangerous. And the last thing is about the spine. So this is a very, very important subject. We have to remember that the biggest problem or the biggest condition in the spine, it's what we call it scoliosis, which means a bend or a curve in the spine more than 10 degrees. So if it's below that, especially in the very young age, usually it's what we call it postural, or I call it postural, which means that when the child, let's say if it's a 4-year-old child and they're standing and you take an x-ray or you examine them, sometimes it's not very precise that you can see because they will tend to move. They are not very stable that you can just say, okay, there's no curve or there's a curve. And very, very important thing to mention here, which is not a worried parent syndrome, it's the DDH or developmental dysplasia of the hip. We really need to be aware that right now, all over the world, it's expanding what we call it the universal hip screening, which means all the kids, all the babies, when they are born, they should have checked their hips with clinical and also ultrasound at the age of 1 to 2 weeks and at the age of 2 months. And there are special conditions with a very high risk kids which needs to have this done even at the age of 6 months. So by that, I hope that this was a brief presentation about what we call it the normal physiological conditions, which you don't need to worry about. And in case you have any questions or anything you would like to ask about, please don't hesitate to communicate with us through the social media. Thank you so much.